what we need when we're discussing mobilizing community for health is a definition of health. And the one I propose here is the fact that health is produced in everyday life. That's what Roberts tell us, that's what the world premiere movies tell us. But essentially, if we're thinking that health is produced in everyday life, it's because we're transforming health-related resources into health. And these are the basic resource with which we can build our health. So I propose that at the end of the day, health is the correspondence between individuals' capacity to transform resources into health and the accessibility of resources in the environment. At the end of the day, what Lynn was talking about is the big forces that create the resources in people's community that they can use to build their health on a daily basis. Health is spatially distributed. This is Montreal. On your left, it's the map of lower education. On your right, it's the map of health expectancy. There is roughly a 10-year difference in life expectancy if you live in the West End Montreal compared to if you live in downtown Montreal. And these two maps are mostly similar, where you will have pockets of poverty indicated by low education. You will have lower life expectancy. So what's happened at the community level is really how do we make resources available for people to create their health. So for us, and in our work in Montreal, we are starting to define local settings or communities as pool for resources for health. And what creates inequality, it's the differential in quantity and quality as well. And those two things are totally important. In local settings that are partly as well determined by the practice of people in those settings. So there are corner stores who are selling cigarettes by the unity because there are people buying those cigarettes by the units. But there are people buying the cigarettes by the unit because there are stores selling them. So the practice in everyday life creates our environment, which is also partly shaped by those big forces that Lynn was discussing. So what we think is that there are two necessary conditions for resource to be used for health. The first is the rules of access, because it's not just that resources are present, but the rules of access to these resources needs to correspond to individuals' entitlements. Entitlement is a big word. The Nobel Prize in Economy, Amartya Sen, won his Nobel Prize in 1996, essentially by showing that during famine, and the Great Famine in Ireland, for example, there were boatloads of wheat leaving Ireland. Irish people were dying, starving, essentially because they were not entitled to wheat. Their potato crops was failing. But this idea of entitlement is, what does your position in the social ladder entitles you to claim as a resource for yourself? And of course, this idea as well that we need to have the capacity to transform those resources into health. If you cannot cook a nutritious meal out of raw vegetables, you are lacking those capacities. So that's exactly what I've been saying. So the way we conceive of environment essentially are domains for accessing resources. And we conceive environments as two main domains, physical environment and social environment. and 4 rules of access. The first rule is that of proximity. You can access those resources because they're right there. Well, it happens that in Montreal, for example, if you live in the poorer neighborhood, you will have access to more heat in the summer because there are less trees. If you live in a Westmount neighborhood, you will have access to cleaner air. So those proximity is a rule by which you have direct access to those resources. A very, very big domain is the economic domain. And the rule of access in the economic domain is the price, is your ability to pay with economic capital what is needed. And let's take the example of housing. If you have a good salary, if you have a regular income, you can afford such or such type of housing. And you go on the market. Another type of domain through which you can have access to resource is the domain of institution. And what entitles you to claim those resources is your right. As a citizen in Canada, we all have access to free health care for a minimum basket. Well, if you're a refugee, an illegal refugee, you're not entitled then. So through institutions, you have rights to claim some of those resources, provided that you meet the agreed upon requirement. In housing, this is social housing. If your income is lower than some threshold that is agreed upon, and if you meet a certain number of conditions, and if you wait long enough, you're entitled social housing, if there is social housing in your environment. And the other one is what we call informal reciprocity. There's a lot of resources that we acquire through this form of sociability. So, and we divide it into 2. The one is community organization domain, the one that we usually call social capital, but it's not social capital at all. It's just informal reciprocity that we give and take, not because of a price, not because of a right, but just because we feel that this relationship is important. And there is also the sociability, the friendship that we have. So in terms of housing, you may decide that you create a co-op, and those people that are like you will belong to the co-op, and you co-opted them. So this world and the critical part of this world, it creates a us and a them, and this is essentially based on identity, whereas local sociability essentially is when this son of a friend that you have somewhere in the world is traveling in Nova Scotia, and you just tell your friend, well, tell your son to have a bed in my place. It's not the son, it's not the bed in your place, it's just because it's a friend, and you reiterate the relationship with them. So, what do we mean by mobilizing communities for health? Essentially, what we mean is to try to make those domains work together and work in sync to create the access that will correspond to people entitlement in the community. So for proximity, for example, what we will try to do is first monitor and ensure the quality of physical environment in function of individuals' capacity. You will not have the same type of park or the same type of green spaces if you have an aging population than if you have a children population. You will adapt those to their capacity. In terms of the institutional domain, well, that's the intersectoral type of action. You will ensure, you will support a rich and diverse institutional environment, which will provide a variety of high-quality service, among which many are not directly related to health and care, and that are necessary in order to provide all resources needed to living a healthy life. There is a reason why we find a concentration of institutional resources in downtown areas, because people need them, because that's where you have concentration of poverty, concentration of mental illness, and concentration of people who are in need, and that cannot interact on the market to get their services. In terms of economy, well, there are two things that you can do there. You can develop alliances that promote broader availability and accessibility of health resource through the economic domain. That's what we're trying to do with corporate, like McDonald's, for example, that they offer a healthy menu somehow. Whatever, we may question what they mean by healthy, but at the end of the day, that's the kind of thing that we're trying to do. But also, and I think that's important, a lot of those negative resources for health are available through the private market. In one of our studies, we've shown that about none of the negative resources are available outside of the private market. So what we need is strong government that will regulate the market, because an unregulated market has a lot of capacity to create a lot of unhealth. And finally, in terms of informal reciprocity, well, you have to support vibrant community organization. At the end of the day, community organizations have a pivotal role for health. They have an in-depth knowledge of the population. They have a capacity to access and mobilize those informal networks and sociability. And most of the time, they are the spokespersons for promoting the local needs of those who are voiceless. And that's one of their most important roles in terms of key mediation between institution and citizens. So, in conclusion, well, health is the result of complex interplay of individuals' capacity and the domains through which health resources can be accessed. And mobilizing communities for health is to work with local actors from all the domains to increase the correspondence between local people's capacities and entitlement and the quality and quantity of health-related resource accessible locally. And if you want to know more and you happen to read French, you can have a look at that. Thank you.